What in the World is Diabetes? Written by Austin Martin, Aleefa Devji, Janani Rajendra, Susie Wu, Tara Y.T. Chen, Alicia O, Sudipta Samatar, Aya Noor Nedi, Maria Gonzalez, Aline L. Awad Gonzalez, Megan Ng. Edited by Naima Mohamud. Narrated by Carson Scott. 9. Opposing Viewpoints, Controversy, Public Opinion by Maria Gonzalez. Although a plethora of peer-reviewed and scholarly resources exist about practically any topic one might feel curious about, misinformation is also abundant and is therefore susceptible to being spread. In order to combat this misinformation, it is important for one to do their own research, verify facts using reputable sources, and develop an opinion that represents their values and morals. It is particularly important for people to consume accurate, thoroughly researched information about medicine, medical doctors, and other topics in the field of health and wellness which have a direct impact on their livelihoods. Diabetes is one of such topics. The disorder has been a source of controversy and dispute because of the confusion and misconceptions surrounding its risk factors, treatments, and who it can affect. Diabetes is a disorder unbound to age, sex, or race, and because of its rising prevalence in the world's population, it is vital to dispel the myths and misinformation surrounding it. Additionally, public opinion on diabetes can be swayed by the attitudes of healthcare professionals when treating patients with diabetes. Correcting misinformation about diabetes can reassure people of the treatment options available to them, increase trust in their healthcare providers, and protect them with knowledge of the legitimate risk factors of diabetes. The idea that sugary foods and their overconsumption are the cause of diabetes is not an uncommon one. Because it is so widely believed, it is one of the largest misconceptions about diabetes that exists. As described in earlier chapters, diabetes has 3 subtypes: type 1, type 2, and gestational. Type 2 diabetes is the subtype people are ordinarily thinking of when they misidentify sugary foods as the culprit behind the development of diabetes, because type 1 is typically diagnosed in childhood or adolescence, and type 2 is the most common type overall. The likely reason for this misconception is the elevated blood sugar levels associated with diabetes. It would therefore not seem unreasonable to suggest that eating a diet laden with sugar would in turn increase blood sugar levels, and this is not necessarily the case. Although overconsumption of sugar is a partial contributor to the development of type 2 diabetes, it is neither the direct nor sole cause. The onset of type 2 diabetes is often attributed to poor dietary habits, which can include the overconsumption of sugar, but concern should instead focus on excess weight. Being overweight or obese is a legitimate risk factor for developing diabetes, and this may or may not result from consuming a diet high in sugar. It should be stated that although most people with type 2 diabetes are overweight, specifically 89% of Americans, according to a 2020 statistic report from the CDC, not all are. Incorrectly attributing diabetes to sugar consumption alone is harmful because it ignores the overarching issue of obesity and excess weight and other risk factors in contributing to diabetes. In saying so, the findings of studies attempting to link diabetes and sugar consumption, particularly sugary beverage consumption, are not always in alignment. In one study conducted on a population of roughly 70,000 Mexican women over a period of 7 years, the researchers aimed to establish a link between sugary beverages, specifically soda, and the development of diabetes. They also questioned whether the potential link between sugary beverages and diabetes could be impacted by genetic dispositions to diabetes or early life factors. Diet, and consequently sugary beverage intake, as well as diabetes diagnosis and treatment, was assessed using a questionnaire. Early life factors and genetic predispositions to diabetes were also assessed using a baseline questionnaire with questions about family history, socioeconomic status, lifestyle, birth weight, and physical activity levels, among others. Stern et al. Found that, after adjusting for confounding variables, the consumption of sugary beverages was associated with a higher incidence of diabetes. It also found that the relationship between sugary beverage consumption and diabetes was stronger in women that were overweight in childhood or young adulthood. One possible explanation for this, according to Stern et al., is that women that were overweight in childhood had poor eating habits for a longer time period, which may have increased their susceptibility to developing diabetes later in life. Stern et al. Suggests that sugary beverages cause spikes in blood glucose and insulin levels, leading to a high glycemic load, which is linked to a higher risk of diabetes. Furthermore, evidence indicates that consumption of sugary beverages made with fructose increases visceral fat growth, which raises insulin resistance, leading to a higher risk of developing diabetes. Fructose may pose a problem. Countries that regularly use high fructose corn syrup in their food have a 20% higher rate of diabetes.
Sample complete. Ready to continue?